I'm Tom Morris. I'm chair of the board of the New York Academy of Medicine, and it's a pleasure for me to welcome you to our 166th annual meeting. And it's always a pleasure to be in this beautiful building and to look forward to the anniversary discourse. As you know, this is an annual tradition, and the discourse this year has a special meaning, I would say. First of all, David Blumenthal, the president of the Commonwealth Foundation, will deliver the address, and it's entitled Birth Pangs of the ACA in Perspective. He might want to change it to placenta previa, but something like that. But this carries on a great tradition of honoring individuals who represent extraordinary accomplishments in biomedical research, clinical practice, public health, and health policy. And many have provided exceptional service to the Academy. And this year, we have a distinguished group of honorees: Drs. Rudolph Janisch, Dr. Daniel Friedman, Dr. Carolyn Clancy, Dr. David Williams, and Dr. Claire Fagan. We are honored to have their presence here and accept our recognition. I would also like to recognize the members of the awards committee, which is chaired by Dr. Ted Shortliff, and they consider dozens of individuals and honorees, and they have done a terrific job in identifying the group we honor tonight. If there are members of the awards committee here, I'd like them to stand to be recognized. Ted, I know, is here somewhere. Ted, to you. Thank you all very much. And now it gives me great pleasure to introduce the president of the New York Academy of Medicine, Dr. Joe Ivy Buford. Dr. Buford.
Thank you, Tom, and let me add my warmest welcome to everyone as well. As Tom said, this event is always a very special one for us here at NYAM, and as we renew our fellowship and members with new inductees in the class of 2013, and in our earlier business meeting, we inducted 52 new fellows, 6 members, 44 new associates, and 21 new students. So we're thrilled with that, and welcome to those of you who are joining us for the first time tonight. We also have an opportunity to honor distinguished contributions of individual members who have really made a difference in their respective fields, and we're thrilled to be able to honor them, and you'll be introduced to each of them as the evening progresses. But the feature of this program is really the anniversary discourse. It's an opportunity to better understand the urban health challenges faced by our communities, and we use these discourses to seek insights and different perspectives on these challenges. We invite speakers who share NYAM's long-term vision of creating healthy cities around our nation and around the world. And tonight's speaker, Dr. David Blumenthal, is no exception. He's made invaluable contributions to health policy and health systems innovation in the United States for many years. Dr. Blumenthal is president of the Commonwealth Fund, a national philanthropy engaged in independent research on health and social policy issues. From 2009 to 2011, he served as the national coordinator for health information technology for President Obama, with the charge to build an interoperable, private, and secure nationwide health information system and to support the widespread, meaningful use of health IT. He succeeded in putting in place one of the largest publicly funded infrastructure investments the nation has ever made in such a short period of time in healthcare or any other field. Dr. Blumenthal is formerly the Sam Thier Professor of Medicine at Harvard Medical School and Chief Health Information and Innovation Officer at Partners Healthcare System in Boston. With his colleagues from Harvard Medical School, he authored the seminal studies on the adoption and use of health information technology in the United States. He's held a number of leadership positions in medicine, government, and academia, including Senior Vice President at Boston's Brigham and Women's Hospital and Executive Director of the Center for Health Policy and Management. Dr. Blumenthal was a practicing primary care physician until recently, and director of the Institute for Health Policy, professor of medicine and health policy at the Massachusetts General Hospital and Partners Healthcare System and the Harvard Medical School. He is the author of more than 250 books and scholarly publications, including most recently, Heart of Power, Health and Politics in the Oval Office. He is a member of the Institute of Medicine and a former board member and national correspondent for the New England Journal of Medicine. He's also served on the staff of the U.S. Senate Subcommittee on Health and Scientific Research and is the founding chairman of Academy Health, the National Organization of Health Services Researchers, as well as being a trustee of the University of Pennsylvania Health System. Please join me in welcoming NYAM's 166th anniversary discourse speaker, Dr. David Blumenthal.
Joe, thank you for that very kind introduction. It's great to be here. I have an apology to make, which is that I think in the interest of brevity, Joe said, well, you can come if you have an early flight back to Boston, which is where I live. And I do have an early flight back to Boston, so I'm going to only be able to spend about 25 minutes with you, but that will assure you that I will not drone on this evening. I'm going to talk about the Affordable Care Act. We all know that the Affordable Care Act has not rolled out probably as our president imagined that it would. But I'm going to try to give you some perspective on, at least my perspective, on what actually is happening and how to think about it. In specifically, what I'm going to do is tell you a little bit about the history of the Act, which I think is valuable to keep in mind as we assess what's going on right now. I'm going to try to explain why it's had the problems that it has had. By the way, though I was a national coordinator for health information technology, designing websites was not in my job description. And then I'm going to remind us all of the standards by which we should judge this piece of social legislation, because that fundamental fact, those fundamental facts, I think, get lost in the day-to-day combat that goes on around the law. The Affordable Care Act has been a fragile and often imperiled piece of legislation from its very conception. I can't think of a major piece of legislation that has been more imperiled by controversy and a bitter partisan divide. I don't think there certainly hasn't been a piece of legislation comparable to this in my lifetime, and perhaps never has. So it wasn't ever clear, and I worked on the president's campaign, one of his senior health advisors, but it was never clear to me whether the president would actually take the initiative and push healthcare reform through to its conclusion. And I know for a fact that he was universally advised not to do so. It was in the midst of the recession, deep recession. There were many things on his plate. He could easily have said to the American public, I promised you this during my campaign, but look, things have changed. I've got a country to rescue. I've got to devote my time to other things. So it was a near thing whether the president would actually take on this legislation. There would have been good reason, other reasons not to do it for political reasons, because history teaches us that health care is a very dangerous issue for presidents to get involved in. It's fine to talk about, but if you actually try to pass it, you run into all kinds of trouble. I'll get back to that in a moment. Then keep in mind that in the middle of the effort to pass it, Scott Brown was elected to the U.S. Senate, and the Democrats lost their 60-vote filibuster-proof majority. And many people thought at that time that the legislation was doomed. It was only through an unorthodox, and some might even say barely legitimate, legislative maneuver that then foreclosed the opportunity for a conference to reconcile House and Senate bills, and thereby doomed the the new legislation, the infant legislation, to a number of birth defects, to continue the analogy. It was only in that way that it actually got through the Congress. Then it had to survive the Supreme Court, which inflicted more damage on it by making Medicaid expansion at the option of the states. Then there was the 2012 election. There's no question in my mind that if the president had not been reelected, the Affordable Care Act would not be in the process of being implemented right now. There were dozens of efforts to repeal it from the House of Representatives, and then, at the time it was launched, the government shut down. Think about all these things in the history of a single piece of legislation. Now we have website failures, we have drumbeats about stories of lack of success or failure to meet promises. All of this creates incredible difficulty and incredible uncertainty among people who could benefit from it, people who support it, and feeds enormous ammunition to opponents. Why has it been so difficult for this legislation to get out of the starting block and into implementation? I think there are a number of reasons, and they're not mutually exclusive. One, it is just really, really, really tough to do comprehensive healthcare legislation. There isn't a modern president who has not suffered for trying to do this. Think of President Clinton. Less well-known President Carter got into a huge spat with Ted Kennedy and thereby jeopardized and probably in part lost his second term because of the healthcare issue. The first President Bush tried to tackle it and did so ineffectually, and that did not help his reelection chances. President Reagan passed catastrophic insurance. Remember what happened to that? It is not easy to do healthcare legislation at the federal level. So it's hard. There's also, right now, in great evidence, an enduring property of American politics, which is what some call the nullification movement. It is not uncommon in American politics for extreme factions to arise in periods of social stress and to reject the legitimacy of enacted legislation, to in effect say, this is not my country. I do not accept the legitimacy, and I will refuse to comply with and implement something that has passed the US Congress. That sense of illegitimacy is frankly exacerbated by the way in which the legislation was passed. It didn't go through the normal process. It was passed through a device that avoided the Senate filibuster by using a particular budget reconciliation process. And one might argue that the debate that's going on right now is in some ways the debate that didn't take place, the set of issues that weren't resolved during the congressional consideration of the legislation. We're still fighting about whether it was appropriate to enact the Affordable Care Act. And there is ammunition in the way it was enacted to argue that the debate shouldn't have been closed when it was. So this is a tough, tough prospect by any standard historically. The first month has been a public relations disaster, and it's easy to lose perspective on what's actually happened. So I think two very important things have happened in the first month. One we hear a lot about, and that is that the information technology infrastructure that was meant to support the marketplaces in the federal, in the 36 states that are relying on the federal government, that infrastructure has not functioned. There are a lot of states where it's functioning quite well, California, Kentucky, a bunch of other states. We don't hear a lot about those. New York isn't doing badly. But it's really about those 36 states. There's another thing that happened, doesn't get as much attention, and that is that the effort to defund, repeal, or delay the law using the threat not only of government shutdown, but of default on the federal debt was defeated. And what does that mean? That means that the Obama administration has 38 months until the next president walks across on the Capitol steps to raise his or her hand and take the oath of office. This administration has 38 months to get this law to the point where it is sufficiently part of the American fabric of social fabric that it cannot be repealed. I do believe that within 38 months, this website can be made to work. Actually, I believe it can be made to work in probably 6 to 12 months. Next, I think 30 days is a very tall order. The real question that history will judge, that we will look back on and ask ourselves in 10 or 20 years, is were enough people enrolled in insurance by the time the next president is elected, actually by the time the next president is sworn in, so that it is impossible to repeal this legislation? And furthermore, will enough people of Hispanic origin be enrolled? Because 30% of Hispanics are uninsured. Hispanics are the most important growing voting bloc in the United States. They stand to benefit disproportionately from this legislation. And if they are invested in it, any attempt to repeal it will severely damage the national prospects of the party that proposes it. The Hispanic voters may soon come to occupy in our political firmament the place that the elderly have traditionally occupied. And their needs and wishes will be very important to any party that wishes to have a national footprint. A couple of additional points of perspective. Where are we now with the law? We're soon going to hear some enrollment data from the Department of Health and Human Services. They're downplaying it, and I would second that expectations management approach. In Massachusetts, in the first 2 months under the Massachusetts Healthcare Reform Law, only about 2 or 3% of the eligible citizens had enrolled in the Massachusetts connector. So I would expect that you will see 2 or 3% of potential enrollees, at best, enrolled through the marketplaces or through either the federal or state. That will be greeted with enormous concern. I'm not concerned about it. And part of the reason I'm not concerned about it is that the Commonwealth Fund, during the middle of October, did a survey of people eligible to use the federal and state marketplaces. We found that 20% of eligibles had used the marketplaces. 20% of those had enrolled, so that's about 4%. That would be, I think, about the number I would expect to see coming out at the most if enrollment data is released. The good news about the people who are trying to use the marketplace is that half of them are under the age of 50. A quarter of them are under the age of 30. So the discussion you hear about young people not being interested is not borne out by our data. Not only that, but half of them report their health as being good or very good or excellent, which suggests that adverse selection, at least at the point of contact, is not an issue. And among those who have tried to enroll and not enrolled or have not yet tried, 58% say that they plan to enroll by the time the enrollment period ends March 30th. That wouldn't be a bad record for the Affordable Care Act. in the first 6 months. There are a lot of reasons why the marketplace's IT structures haven't worked. One of them is that IT never works the first time it's tried. And so you might ask yourself, why wasn't it better tested? And I think that some of that has to do with lack of management skill within the administration. But it also has to do with politics. So imagine you're sitting in the White House. You know that the Republicans are intending to shut down the government and threaten default on the debt because they want to appeal Obamacare. And you test this website a month before the budget is going to expire, and it doesn't work. What does that do to your standing and your ability to keep the Democrats together to oppose the shutdown? I think that what that illustrates is the fact that this is not IT as usual. This is IT implementation done in a cauldron of fire where any normal business practice is so politically fraught and so politically dangerous that essentially you're better off dealing with the problem you have now than the problem you would have had if the website had not functioned while the government was, before the government shutdown had taken place. You couldn't do this the way any normal business would do it because of the contentiousness around the law. I could go on about some of the other problems. The procurement process in the federal government, which the president has actually talked about, is totally broken. Has nothing to do with his competence or the competence of his administration. Has everything to do with administrative practice and law. We could go on about that. There's one other thing, by the way, that is critical. Lack of resources to implement the law. When it was my responsibility to implement a system-wide electronic health record at Partners Health System in Boston, we set up an entirely new, separate, parallel implementation organization that was going to have hundreds of employees. And this was for one healthcare system in the Northeast. That was impossible for the administration to do because they didn't have funding to do it. And they didn't have funding to do it because the Congress wouldn't give them the funding. And that was an enormous impediment to effective implementation. I think the website's going to get fixed. We know it can be because California and Kentucky and Massachusetts have all been working. It's not like defying the laws of gravity. It needs the A-team on board, and I think the A-team is now on board. Let's think about how we will judge this law in the perspective of history. We'll judge the law according to a couple of very, very simple criteria. Has it substantially reduced the number of uninsured Americans? Has it substantially reduced the numbers of underinsured Americans, people with insurance that doesn't really function as insurance? Will it maintain the quality of care that Americans receive? And will it control the rate of growth of healthcare costs? Those are all pretty simple, direct standards, and we won't know the answers to the questions. We won't be able to judge the success of the law, I think, for several years, 2 to 3 years at least. If you keep your eye on that North Star, it gives you a little bit of perspective on the tennis match that goes on day in and day out in the press. The president has 3.5 years, almost 3.5 years, to root this law in the American fabric. I think there's a better than even chance that it will work out, and history will be the judge of whether he was successful. So I want to thank you for your attention. I hope some of you may feel discouraged by what I've said, some of you may feel encouraged, and you can invite me back in 3 years and hold me accountable. Hold me accountable. I was a public official, and I knew how to be held accountable. Thank you.